Hello all, it's Dr. Khan once again, and today I wanted to review or talk about another very high yield topic for your board exam, which is vitamins. Vitamins most often or historically have been classified as either fat-soluble vitamins or water-soluble vitamins. Their classification is significant to us because fat-soluble vitamins have the tendency to cause toxicity if you overdose on them. And fat-soluble vitamins contain vitamin A, D, E, K. And rest of all the vitamins are your water-soluble vitamins, and you do not necessarily have toxicity from overdose. Because if you overdose on it, your body has the ability to eliminate it. Now, let's talk about first, fat-soluble vitamin, vitamin K. Vitamin K is high yield for almost any board exams, and it's because vitamin K is involved in synthesis of your clotting factors, which are clotting factor 2, 7, 9, 10, plus it's involved in synthesis of anticoagulant factors, protein C and protein S. Therefore, proper functioning of your vitamin K is important for a balance between clotting and bleeding. Now let's talk about how you could be tested on this topic. You could be asked questions in terms of how or what is the name of the reaction that vitamin K is involved with. So that is gamma carboxylation of your factors, which is important. It is not a post-transcriptional modification, but it is post-transcriptional modification. It is happening simultaneously while your proteins or your clotting factors are being synthesized on your endoplasmic reticulum. If you have an abnormality or deficiency of vitamin K, you will have an abnormality or inability to synthesize your factors 2, 7, 9, 10. Along with that, you will not be able to form vitamin C, protein C, and protein S. So you will have issues with bleeding and clotting. So you'll be bleeding and clotting simultaneously. So what are the conditions that can cause vitamin K deficiency? Vitamin K is synthesized by our gut bacteria, the bacteria that is in our GI tract. And newborns have vitamin K deficiency oftentimes, or breastfeeding infants, because their gut is very sterile. They haven't had colonization of their gut by the bacteria, therefore they have vitamin K deficiency. Therefore, they're oftentimes given 1 dose of vitamin K right after they're born. Second condition that can cause vitamin K deficiency is when somebody is on broad spectrum antibiotics for long duration, and we all know that antibiotics have an ability to discriminate between good and bad bacteria, so they can actually get to your liver and start synthesizing. That might take a little bit of time. That's why you want to give them fresh frozen plasma initially, and then vitamin K, and then you monitor their PT, PTT, and bleeding time. In subsequent video, we'll talk about other fat-soluble vitamins. Thank you very much.